Hello, everyone. Renee and I are going to do a very quick tutorial about Quality Insights Renal Network 5 and a little bit of an introduction for all facility staff about who we are and what we do. So let's get started.
So dialysis really came into its own in the early 60s. It started in Seattle, Washington with really just a handful of machines. And so was a very scarce resource. They had too many people, not enough machines, and it was all very centric in one location. So really not widely available. To deal with this, they developed committees which became kind of got a bad nickname as the death committees. They were formed to determine who would get treatment. And those people tended to be white males. The practice continued as centers opened the country. I imagine one of the criteria was also having the ability to pay for treatment. So it was in the 70s when Congress approved Medicare to cover dialysis and developed the ESRD entitlement program. There is no other program like this in Medicare. It is specific for kidneys, and there is no other program that is in Medicare that is developed or designed or funded specifically for a particular organ. Kidneys has the market on this. It's very unique. It's for a facility to get reimbursed by Medicare, they have to apply for authorization or certification, and that comes with the regulations, which are known as the conditions for coverage. These are federal rules. The facility has to follow those in order to get reimbursement. And the networks were created to support this program and drive quality improvement. So you can see, looking at this slide, that the number of people on dialysis and the number of treatment centers has grown quite a bit over the years. And the program actually started with 32 ESRD networks across the United States, and they've reduced that down to 18. So we currently have 18 networks throughout the United States. Over the course of the years, the Centers for Medicare and Medicaid Services, also known as CMS, pushed different quality initiatives. A number of them are listed here. I'm not going to go through them. But you may be very familiar with some of them. But some of these initiatives were directly tied to facility reimbursement based on performances or scores. The network is usually contracted to work on various parts of some of these initiatives, such as identifying facilities that aren't meeting certain quality measures like adequacy or infection rates. And then the networks are involved in developing interventions to help facilities improve in those areas.
Our coverage area for Network 5, we cover the states of Virginia, West Virginia, Maryland, and the District of Columbia. And in total, for our network, we have 451 dialysis facilities with 14 transplant centers. And that equates to over 28,000 patients and 17,000 transplant recipients. And this is data as of January 3rd of 2022. Going into a little bit of our network responsibilities. The first thing being improving access and quality of care for all end-stage renal disease patients. We want to encourage patient engagement and help the patient engage in their care and the type of care modality that they would like to use, whether that's home or in-center, peritoneal versus hemo, supporting ESRD data systems and data collection, and we'll talk about that in a few slides, We provide technical assistance to ESRD patients and providers and evaluate and resolve patient grievances.
So as I mentioned earlier, for a facility to receive Medicare reimbursement, they have to be certified and agree to follow the federal regulations, which are the conditions for coverage. There are also legal documents that are called agreements of participation, and those indicate that the facility will participate in network activities and pursue network goals. The network goals are driven by its contract with CMS. CMS is the entity that creates the goals that the networks are driving towards. So those goals are posted on our website.
Facility responsibilities. So with the goals that are driven by CMS that Renee just mentioned, part of your responsibility as the facility are to pursue these network goals. So we ask that you participate in our quality improvement activities, which I'm sure you're all very familiar with, engage in technical assistance with us, join network facilitated coalitions. And usually this is, there's a coalition that is based around each topic or measure. Right now, for this current contract period, our areas of focus include improving behavioral health, improving patient engagement, increasing vaccinations, and that's not just COVID right now, that's also pneumonia and flu, utilization of home modalities and transplantation, decreasing catheter infections and peritonitis, and decreasing hospital utilization. We also inform patients, or your responsibility would be to inform patients of available network resources. We have a lot of resources available on our website, but also the resources that we send to you when we provide technical assistance. And this is including grievance resolution, any education material, peer-to-peer mentoring, patient and family advisory council information. We also ask that you notify us at the network of any major events. So this would be emergency closures, any leadership or staffing changes, and responding to inquiries and requests for information. So we will reach out on an as-needed basis if we do need specific information about your facility. And we just ask that you would timely respond to that so that we can make sure everyone's on the same page and our records are up to date. In addition, we also look at these data systems. So we have NHSN and EQRS. For NHSN, this is what we're using to track COVID-19 infections and all the vaccination data. So this, right now, this information is due to be submitted every Wednesday by 2 p.m. and that is for the previous week. Weeks run from Wednesday to Tuesday. Outpatient dialysis facilities that participate in the QUIP program, that event reporting is due quarterly, and you can see the timeline for that located in the green here. Outpatient dialysis center practices survey, that is due annually by March 31st. For EQRS, this is where we keep track of patient admissions, and those must be entered within 5 business days of the patient being admitted. The 2728 forms for all newly diagnosed patients must be submitted within 45 days of the patient's admission, and the 2746 form must be submitted within 14 days of the patient's death.
We have several lovely staff members. All of them are very helpful and supportive. Brandy Vinson is our executive director, and she is the person that we all answer to at the network. Amber Paulus is our director of data science. She is the person that we depend on for our analysis of data. She's the one who helps us make sense of the information and what to do with the information that we have, including information that we don't have. So she is a very vital part of the quality improvement efforts that we undergo. Heather Cecil is our outreach coordinator. You may be very familiar with her. She is typically the person who will reach out to you for information related to projects that, that we haven't received yet. She also is very involved in the Five Diamond program, and the person, the lead person who receives information related to that. Allison Crittenden is our data specialist, and she works in conjunction with several other members of our team from our sister units, Cheryl Brown, Karen Hyrick, and Tricia Felchand. They are in networks 3 and 4, which is north of us, but they are part of our quality improvement organization. Allison, you talked to a lot about information that needs to go into EQRS, which used to be Crown Web. You may be more familiar with that name. But she is the person that you typically go to for form submissions, corrections of data, and difficulties that you're having entering information into EQRS.
We have our patient engagement staff. So we have the lovely Renee Bovacalis, who is helping run this tutorial with me today. And we have Phyllis Haas. They are both social workers and our patient engagement specialists. So you will contact them for grievances, anything related to patient experience of care, and voluntary discharges. And we also have our quality improvement staff. So this, our quality improvement staff, we have a mix of specialties. So we've got a couple nurses, and we've got a social worker, and then we've got Kelly, who is NPA. I'm Caitlin Booth. I am a registered nurse by trade and a quality improvement specialist with the network, and currently lead our hospitalizations and nursing home projects. Andrea Moore, she is a social worker by trade, and she leads our behavioral health project currently. Kelly, she leads our home modality project, and Amanda Morelli is leading vaccinations and transplant. So how we help. As I stated in the previous slide, we have experienced staff from many different disciplines. So we've got a huge variety of background between us, nurses, social workers, and project managers. We lead the quality improvement activities that are designed to improve patient care. And as mentioned earlier, we've got several topics. So that includes behavioral health, infection control, vaccinations, hospitalizations, home modality transplant, patient engagement, and grievances. And with surrounding those topics, we provide technical assistance, and we really try to target that technical assistance to your facility needs and the barriers that your facility is experiencing. So no facility is alike, and we recognize that barriers that your, one facility may have may not be at all applicable to another facility, and that can be based on location or patient demographic. And so the assistance that we provide to you all, we really try to target that to your specific facility needs. We do this in several different ways. So we provide one-to-one coaching calls, Zoom calls. We can email you different resources and educational material that we think could benefit you. And we also assist with root cause analysis and RCA. A little bit more on education material. We do distribute that. We have a couple different ways that we do that. One of them being our alerts, which keep you informed about different education opportunities, which can include webinars, meetings, anything pertinent to CMS and any changes that they may have. In addition, you see a lot of stuff about education on here. We do face-to-face meetings or Zoom calls nowadays. We can do webinars based on information that you give to us. So say you have a current issue about catheter infections in your facility, we can do a webinar about that. We also do conference calls. And we also share data. So we can help dig into data at the network, state, and the facility level. We have a really awesome dashboard that we use to look at that. We can provide incidence, prevalence, demographic statistics. We also have a way to look at health equity data right now. If we need to target a specific facility to, help improve health equity in that area. We have our annual report, and then we also provide monthly feedback reports to track your progress for those CMS measures. And I also want to say here that even if your facility is not enrolled in a specific QIA or specific project, your facility is still held accountable to all of those CMS measures, whether you're enrolled in a project or not. And we will provide a monthly report so that you can see where you're at with each of those.
So another big role that the network plays is in resolving patient grievances and assisting facilities with difficult patient behaviors. Patients and caregivers can call us or they can write us for assistance, and we can help advocate on their behalf. We are charged with ensuring that the regulations are followed and that patients are given every opportunity and assistance by the facility to cope with the burden of their care. So our processes are very much dictated by CMS, but we are a resource to facilities when you all are having difficulties with patient behaviors. You can give us a call, we can help brainstorm. It is very helpful to have a third party to bounce ideas off of and to check in to ensure that what you're doing is appropriate, that it's adequate, and that, that it gives the patient as much support as it can. So always a very good idea to contact the network when you're having difficulties with patients. Certainly it is something that is very helpful in keeping behaviors in check, helping to manage those difficult behaviors. And really the idea is to ensure peace in the facility and avoid it escalating to a point where there are outbursts in the facility or an unfortunate situation where a patient is no longer welcome in the unit. So early contact with us is always the best, but constant communication, and we've got resources, we have training, we have all kinds of things that we can do to help support you, as well as the patients and their caregivers. So when we are reviewing cases, we may look at medical records or facility policies. We have legal authorization to request those and receive those from you all. We have nurses on staff and our MRB, all of which help us to make medical judgments. And we also work in collaboration with the state survey agencies, the departments of health with each state. And we will refer cases to them when we find that conditions for coverage have been breached.
So next steps, you can visit our Network 5 website on the web, and you can see that address right here. It's really simple, QIRN5.org. This is where you can sign up for alerts, report facility closures, and view our huge array of resources that we have based on each project and each measure that we're currently working towards. Update your grievance posters and other patient-related material. We do have a new mailing address, as you can see here. And of course, contact us if you have any questions or need help. Our contact information is listed here. We hope that this helps you understand what exactly the network is and what we do and how we can assist you. We are really, we exist to help you provide optimal patient care, and I hope that you find this helpful. Thank you so much.